Hello, good day. I'm back again at CSA Medical Aesthetics, and once again I'm Carmela Salvador Alapag, if you can still remember. So that's 2 months ago. I had a treatment here, the so-called Sculptra treatment, which actually gives volume to my face, and I had seen the result actually, especially in my case that I work as a call center agent. I work during the night, so graveyard shift sabi nga nila, and basically pag ganun yung klase ng trabaho, it actually would make a difference, especially sa face features, lalo na sa akin. Kapag napupuyat ako, lumalalim yung dito ko. Ito yung unang nakikita sa akin. But with the Sculptra treatment that I had last time, I have noticed na parang kakaiba. Even my colleagues, okay, some of my friends told me, Mami Carmela, but parang something new sa face mo, ganon. And I told them about this Sculptra treatment. It really is a very, very good treatment. 2 thumbs up. Actually, kung meron pa akong ibang thumbs up, I might give 10 thumbs up with that. And so there you go. I will have my second session today, and let's see if there will be much difference more in my face. Don't forget to subscribe into this YouTube channel by Dr. Tessa, and hit the notification button as well, so for you to be updated with the latest trends and updates in the world of beauty and skin clinic. So once again, I'm here at CSA Medical Aesthetics for Sculptra treatment. Magandang buhay and salamat po.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. It's the treatment of Sculptra, entitled Restoring Youthful Glow with Sculptra. And we have with us again, Ma'am Carmela.
Po. Good day po. Kamusta po? I'm back.
So it's the 8-week post-op of Ma'am Carmela. And we were doing an assessment a while ago, checking on her upper third, middle third, and lower third. What we noticed was the improvement in the tissue laxity. Okay? Before, when we were doing like this pinch test, okay? Pinch test is like this. There was like too much of the laxity, right? Remember, Ma'am Carmela? And right now, I was pinching her skin. There you go. When you say improve skin elasticity, when you pinch your skin, then you release it, it instantly goes back to the original position. So when I'm pinching her skin, instantly it restores back, okay? Because last time, 8 weeks ago, when I was doing this pinching, it was so loose, okay? Right now, when I'm pinching her, it's already improved. Right, Ma'am Carmela?
Yes po.
So what else have you noticed? apart from the laxity, of course.
Apart from that, there's volume in here. Kasi before, my problem is laging, it's so deep on this part.
Sunken,
Yeah,
yes.
it's a sunken
Right.
line.
Yeah.
But then again, I've noticed na every time I look in the mirror, but parang there's something parang something good, something ganun.
Yeah.
Parang there's a difference. Even my
Right.
colleague noticed it.
Yes.
And they kept on telling me, Mami Carmela, what happened to your face? Bakit parang there's something new? And then I told them about this treatment.
Okay, there you go. So, it also improved that volume loss. There was volume restoration. We explained before that Sculptra with PLLA stimulates collagen elastin during the first month, even up to the second month and the third month. And we're just on our almost second month, right? So it is still working inside. Your tissue buildup still happens. The fibroblast tissues are still creating newer collagen and elastin tissue matrix plus some of our glycosaminoglycans. So your volume was restored, elasticity was improved, plus skin texture, you notice there's also an improvement in the skin quality, right? And there's the so-called Sculptra glow. So just one treatment, we've noticed already an improvement. As time passes by, your skin is getting better and better. And take note, we're doing a second session right now. What more, right? So we have experienced, we have achieved that goal of skin quality improvement, the restoration of volume, plus improvement of the tissue laxity. There you go. Also on the temple region, because I know she has this hollowness in the temple areas and hollowness in the subzygoma region and the lower cheek region. So there's a noticeable improvement already. And the thing is, people are seeing something is happening in your skin, or people are noticing that you are improving and getting better, right? But they don't have an idea what you have done. So these are the kinds of treatments that people are observing or noticing that something is improving on your face, but they're not aware that you are doing an aesthetic treatment. Because some people don't want others to know, oh, I'm going to this aesthetic center, something like that. But they just really want to improve their looks and become more of a natural and younger versions of themselves. And we know that PLLA would last up to 24 months according to studies. Okay, Ma'am Carmela? So we're all excited with the second session. We'll show the procedure when CSA Medical Aesthetics return. And we're back. So we are the part of doing the facial assessment. We have the so-called FAS or the facial assessment scale here that we follow with our Sculptra treatment. So we did an assessment in the past during the first episode, during the first session of Ma'am Carmela for the Sculptra treatment. Okay, so right now this is my assessment for her. So the one that really improved remarkably was the volume loss as well as the sagginess, and at the same time the radiance of the skin and also this so-called firmness of the skin. So we had an improvement with that thanks to the Sculptra. So this is the second treatment already. So we want to further improve the quality of the skin. We wanted to improve the radiance, the firmness, the sagginess, the volume loss, up to a point that we reach that so-called center there, the number 0. That is the goal of every aesthetic treatment. That we have this, for example, a problem of a severe, and then we want to make it moderate or less severe, and then convert it to mild until we reach that point of 0 problem already. If still your skin collagen is still able to synthesize new collagen. Of course, we have our fibroblast cells that will still be working and they will still be activated. The more fibroblast cells you have, the better. That's why you have to start it earlier. Don't wait for all your fibroblasts to be senescent or deactivated. So really have to start as much as possible at a younger age. So Ma'am Carmela is 45, correct? Right. So 5 years from now, 10 years from now, she will really look better, actually more beautiful. This is the kinds of treatments that as time passes by will make you a lot younger and more beautiful. Because whenever we're doing injectables or these aesthetic procedures, we notice our patients when they keep on maintaining treatments like this, they notice over time, they even become a lot or more beautiful as compared to when they were younger because of the improvements from these kinds of treatments. So usually that's the assessment part. So from assessment, you do your upper third, your middle third, your lower third. You check all of those. So not only you check on the volume, not only you check on lines, wrinkles, right, it's there, or grooves or folds there, but also look for the skin quality plus the so-called skin laxity. So I'm trying to pinch the skin right now. So there's an improvement already. Like how many percent do you think? 50% improvement already, right? So that's a good one. So because she's still young, she has good like skin fibroblast, still active fibroblast, okay? So don't wait for all your collagen to go away before you do treatments like this. The earlier you start, the better. So that's the assessment. Now, anatomy-wise, of course, we always follow right anatomical layers and avoid like blood vessels, facial nerves, okay, to avoid also complications, to prevent complications from happening. So doctors who are doing this are well versed with the anatomy, okay? So landmarks, let's do the landmarks, okay? Again, when we do Sculptra treatment, so we're working on the areas of the temple, this mid-face and lower face, but we have to avoid the forehead region, the near the orbit or the eye area, the center, which is the nose area, and then also the oral region or perioral region. So those are areas that we have to avoid with our Sculptra treatment. So we're working on the periphery of the face up to this medial aspect here. So your temple fusion line here, your lateral orbital rim there, and then you can reach or draw your inferior orbital rim there. And then also you palpate for your zygomatic borders here, okay? And then you divide the sides of the face into two parts, like we have the stationary or non-mobile zone here, non-mobile zone, and the medial aspect is the mobile zone, okay? So avoid again forehead, nose, and also the lip region here. So basically, when we do compartments of this, we can work on like your preauricular region here, and you can work on your this aspect here and this aspect here. So you can subdivide your regions of the face, and then we can also work on this part here. I do subdivisions of the face whenever I am working on the face region and even the prejowl sulcus. There are like co-doctors of mine who will tell you to avoid the jowl area here because you don't want this to further like go down or sag, okay? So this part, we want to avoid the zygomatic because she has this high zygomatic prominence here, okay? But we can still work on this temple region. I could still add more here, here, and here, and also here. And actually submandibular, you can also work. This time I'll be doing a combination technique. I'll be working on with my so-called linear threads. I'll be doing the so-called linear threads to improve this lower third and also the submandibular region. I'll be doing the so-called linear threads. And this part here, I'll still use my cannula. So this one is cannula, 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 up to this part here. Okay? So these are now my markings. I'll be doing a combination method right now or techniques. So both cannula method and the needle method. Okay? So we're starting with our injection procedure. As with any other injectables or injection techniques, we have to disinfect the skin, we cleanse the skin. We actually left a numbing cream for about 45 minutes before the treatment. And then this is just a chlorhexidine spray to disinfect. So I'm not gonna be removing anymore the markings here for our those who are watching this and trying to learn the procedures and the techniques, okay? So my entry point, starting from this part here, between the upper and lower borders of your zygomatic arch, okay? I'll create a puncture there. So I actually use the pain freeze to numb this skin area. So this is a gauge 18 needle, okay? And then puncture. So do your rotation of this to help in the widening of the entry point. So this is already the prepared Sculptra. So we did the mixing a while ago. You already have a video of how we mix or prepare our Sculptra. we use like a total of 8 ml sterile water. And this time we added like 2 ml of our lidocaine for a total of 10 ml. Okay, so I had my entry point there, and then direct my cannula here towards the temple region again to further improve our temple area. Okay, you can reach up to the temple fusion line there and then push your product. So it's important that you push an equal amount in every line that you are injecting. Okay, we go to the posterior aspect. So this is the so-called fanning method. Okay, you can even go up to the hairline region there to fill that in. Okay, every time you push, make sure that it's a balanced amount that you are pushing into this tissue layer of the temple here. Okay, so ideally the area to place this product is the so-called layer 2 or the subcutaneous superficial fatty layer. Okay, so I can now direct this product into the anteromedial cheek. So we still wanted to improve the cheek area to have more volume here, and you know, the cheeks should have that good anterior projection, or the so-called OG curve, or the so-called cheek convexity. Okay, so I want to reach this mid-cheek area here, the so-called, because sometimes we have mid-cheek groove here, we wanted to treat that as well. Okay, so some resistance already here. Okay, when you've done procedures in the past, expect some development of like fibrous protein tissues there, and we will be directing it towards this anteromedial cheek. So I'm delivering the product again, and then fanning method and subcutaneous plane using gauge 22 or 23 cannula. Okay, actually gauge 25 is also fine. So this is cannula method of our Sculptra. Again, my Sculptra was mixed with sterile water, 8 ml of that, and also 2 ml of our lidocaine. So some will mix like 8 ml sterile water and just 1 ml of your lidocaine. So again, the anatomical layer is layer 2 or the superficial fatty layer. As we age, the superficial fatty layer atrophies or shrinks, especially on the mid-face section. So most of the time, we do correct volume in the mid-face section. And as we age also, those superficial fats, they may sag or descend towards the lower third of the face. So when they descend to the lower third of the face, the lower third kind of become, you know, like hypertrophic fatty tissues on the lower third of the face. That's the so-called pyramid of age or aging, creating that shape of the face like a triangle or like the pyramid, or we call it the heavy bottom appearance face. So I'm already on this lower aspect here. So using the same entry point again, okay, so you can direct your cannula towards the lower third of the face there, so you can improve any subzygoma depression here. Some volume loss in this preauricular region, you can also improve. So this one will stimulate collagen here, will form collagen again, and will restore the volume of the face. So again, PLLA particles can improve the volume, and they can synthesize new collagen and other protein tissue matrix. Okay, so this is a very good product as to the type of people who can receive this. So those who are already noticing the aging of the skin, the sagginess, volume loss, and also tissue laxity, problem of loose skin, you can have this. Okay, so the age range could be from 30s to 60s. Okay, those who can still stimulate collagen formation. Even the young ones like 20s, they may start this if they just want to do the so-called, like, prevention or delaying the aging process. Okay. So I'm actually in the non-mobile zone, the stationary zone. This part here, when you improve the volume here, you can also kind of indirectly lift your medial aspect of the face. Okay. It's expected to have some tissue resistance in this area, in the lateral aspect of the face, because we have a lot of fibrous septa here, connective tissue bands here. Some people had acne scars, so those who had acne scars, they can also notice improvement of those depressed or sunken scars. And those who have melasma, there's a report of brightening effect of this one because of the collagen stimulation. And the stretching of the skin can stretch the melasma pigments, improving their hyperpigmentation. So for my patients who have the melasma problem, you can also use this for that, apart from anti-aging, volume restoration, improving skin elasticity, also pigmentations you can address with this Sculptra treatment. Okay, so some resistance there, and we're almost done. Okay, I'll also combine it with the so-called linear threads using a needle. Okay, so 1 mil here, so we can improve the lower third of the face. So I had the parallel serial lines here, like a horizontal short lines here. Disinfect, please. So it's important to always clean the area, disinfect, sanitize the region to make sure you have a sterile procedure. So in doing this, so just a linear thread here, short strands here, short strands. So there can be a combination of this kind of procedure. Okay, again, subcutaneous injection. It's just that when you're using needle, expect microbleeds there, unlike the cannula. Actually, I really prefer cannula method, but for the sake of those who also want to learn more about other techniques, other way to deliver your product, this is another approach there. Okay, just the subcutaneous. Okay, so I still have one more, so I can still add here. So some pinpoint bleeds there because we are using a needle technique. Okay, we're almost done. Actually, for those with acne scars, this is a good technique. You can fill in those sunken or depressed atrophic scars secondary to the inflamed acne. Okay, and almost done. So we can improve tissue quality here, restore the natural skin's elasticity, restore volume, it's anti-aging, it's gonna restore that youthful glow. Okay, so we're done with the right side, then we'll proceed to the left side. So we've done the Sculptra, cannula, and needle method. We'll show the result when CSA Medical Aesthetics returns. And we're back. We'll now show the result to Ma'am Carmela, her Sculptra second treatment. And here's the mirror. Okay, hold this. There you go. So as a review again, we did the Sculptra treatment temple region, anteromedial cheek, preauricular region, the lower part of the face, the mandibular area, and submandibular. We had cannula method and needle method. And Carmela is looking a lot better right now. So volume was improved, then the sagginess was improved, then skin radiance, skin firmness, skin elasticity, they're still improving. Okay, so during the first month already, we start to experience this collagen formation already. Okay, so some of the young collagen are starting to be synthesized or produced by our fibroblast cells. Okay, the good thing with this Sculptra, they stimulate cellular or tissue response, and there will be release of growth factor peptides there. Those peptides are the ones we call like peptide or like the platelet growth factor, platelet derived growth factor, the fibroblast growth factor, epidermal growth factors, the vascular endothelial growth factors, TGF-beta, and all other important growth factor proteins to help restore dermal tissue connective matrix, as well as some subdermal tightening there, and also, you know, restore that very good quality of the tissues, okay, and prevent aging, fight aging, and it's gonna make us look a lot younger. Comments, Ma'am Carmela?
Speechless. It's really is a wow.
Yeah, right. Yes.
Para lang nung parang nakita ko yung sarili ko when I was in high school.
Yeah, there you go. That's the goal actually. So we wanted to bring back our like original skin tissue quality when we were a lot younger, when we were adolescents. Okay, why not, right? So this is a simple treatment that we can do in our center. It's a quick procedure. It can be a lunchtime treatment, a coffee break treatment, and I could say no downtime to this one. So just after this, okay, because Ma'am Carmela had work last night. She works night shift, right? That's why she's still having some acne because of the type of work, your type of work, okay? Sleepless nights, okay? It stimulates her stress hormones. She still gets some acne. That's why this Sculptra is also good for those who have like acne marks or some acne scars. It's a good treatment for that, or those with pigmentations also. Okay, so even if you're like your job is like adding age on you, but you're doing a Sculptra treatment which will subtract ages from you. Wow. Okay, so if you even work like a stressful lifestyle, you need to do something for your skin, okay, to fight the, you know, the adverse effects of the stressful lifestyle or stressful work you have. Okay, so these are the kinds of treatment that you can do. Like she came from her night shift, she went here. It's an easy procedure, no downtime. She can work again tonight. Okay, so after this, just do your massage. So it's normal, like tomorrow you'll feel some tenderness, but those are manageable and very tolerable. Okay, so also do cold compress. Okay, optional to take any pain reliever if there is some discomfort, like you can take any acetaminophen or Biogesic. Okay, thank you so much, Ma'am Carmela, for joining us again. We'll have a third session for her. I think we have viewers who are like trying to, what do you call that? Monitor or watch your improvement. Somebody even told me, let's see after 7 months. So what will be the effect? So this is already like a 2-month post-op. So we'll do another third session, like 6 weeks from now, 6 to 8 weeks from now, and we'll see how this PLLA microparticles Sculptra would improve Ma'am Carmela times 10 younger. Okay, and I could say that with the, I think, face reshaping also, it improves that right shape of the face, because women wanted to have this V contour right now, although ideally it's the oval shape or the inverted egg face shape is the ideal one for women. Okay, thank you so much, Ma'am Carmela. Thank you.
Thank you, Doc.
Yes.
And thank you, Sculptra. If you have any question, you can message me. Just look for my name, Carmela Salvador, for more inquiries. It's the best. Ang ganda talaga ng ano. First session pa lang, there is a noticeable improvement.
Improvement already.
What more ba?
Yes.
Second session.
Right. So in addition to that, actually, we haven't done any treatment for Ma'am Carmela. It was just all Sculptra. We haven't done any toxin injections nor hyaluronic filler. Actually, I was recommending to her, like, you still have to improve your forehead wrinkles, okay, and the mid-face section. We can use some toxin and fillers for her as well. Okay, thank you so much. If you have any questions, you may also email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other videos, even the first part of this Sculptra treatment of Ma'am Carmela. Just type Contessa Salvador and please click the like as well as the subscribe and the notification bell to keep you updated. Okay? So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.